the Parent-Child Center is to help young families get off to the right start so that everyone can really have the support they need wherever that might be. So it's about being family-centered, and then what you're doing is family-driven. So a family will decide what that right start means. I mean, again, it depends on the family. So we have lots of sort of pots of money and things like that that can help families. But I think most importantly, we provide a sort of a home base and a place where, a place that families, the parents can build relationships and kids can build relationships that are really healthy with people, and then be able to sort of figure out how to work in the larger community and systems if they need help with housing or with reach up or getting a job or finding new childcare or getting a divorce or making sure you have full custody, things like that. So and getting a doctor. I mean, it's sort of going to the dentist, for both generations, and then helping with relationships, getting out of bad relationships, things like that. So I think it really depends on the person but I think what we really provide is a healthy relationship base so that people can really grow. With the Parent-Child Centers, we have really hubs for young families, so both for early childhood services and for their parents, which is at least, and sometimes grandparents. So 2 or 3 generations at a time, we are able to provide, be a hub and sort of one-stop shopping, for lots of different needs. Whereas I think many other social services agencies provide lots of support in certain areas, but not sort of across the board. I'm one of the co-directors, so I actually, a long time ago, it wasn't to me as a co-director, but it was to my other co-director at the time. They were writing, one of the participants was writing certificates to celebrate all the staff. And it said, "Thanks for doing all the boring stuff so we can all be here." And I think that's what I feel like I do now, all the boring stuff. So I do a lot of the administrative work. So, making sure all the staff have health care and making sure that, all of that stuff. So all the administrative work, making sure the money's flowing, so everyone can get paid. Making sure when there are things up around big, policy or rules or how we want to operate, sort of helping navigate that. And just, I think, to me, it's sort of like in a more positive way than saying doing all the boring stuff. It's like, I feel like I help create and hold a container for people to be in community. I'm trying to think. I want to on a few levels. It was funny because I think when I got here, just even in an interview, it was really funny. Just to start, I had gone out and I'm like, oh man, I don't have any shoes, right? So I had to go buy shoes for this interview because I worked in some hippie organization before that, and so I was like, oh, and sort of nervous, and I got here. Nobody wore shoes. I was like, what? Like I went and returned my shoes. But it was really funny. But I remember having this feeling like I landed, and then I got offered the job, and I came, and that was in '98, and I've been here ever since, and I was so happy to feel like I found a place I'd want to spend my waking hours working at. So that sense of just the feeling of like knowing you're in the right place. Is how it started. And then I think hardly a day goes by where I don't always break into tears, but to hear people's stories, even stories I've heard lots of times, is an incredible gift to me, and to see people change and grow. And we work both with really little kids that grow and change and are amazing and hysterically funny and highly entertaining, and just incredible, like to see their growth. And you're going to see that, but to see that with their parents too is really a gift, I think. And I think I learn something every day from both the people I work with and the people we work for. We have a dad actually here right now who came here and graduated from high school and then was gone. Now he has a baby 10 years later. I think that's a success story, that he didn't have more kids from when he was 15. He waited in time and now is more established, is in, a healthy relationship and has a young child, and feels like, when I hear him using the phrases we use, and, I think if you were walking down the street, you might not know he was a success story. He still drives a junker car and he still does, but when I see him with his child now, I know he's a success story to me. So that's one, I think, every day, again, it really, I see people graduate from high school that no one in their family has done that, going on to college. Actually, one of our former participants is graduating this with associates from CCV. No one in her family had ever graduated from anything. So that, and again, we see her kids happy, healthy. People come by. Actually, a woman from our first flyer, was a baby on our flyer, just came back to visit. She's a grandma now, But again, she was, one of the first things she wanted to tell me was none of her kids were teen parents. So every day. The amazing stories. Come visit, come see for yourself and talk to people, because I think for any of us, it's easy to judge someone else when we don't understand their story. So I think when we hear someone's story and have more of an understanding about what it means to raise a child in poverty when you haven't had positive role models, like to do that, again, every day I'm amazed. If you have, make $500 a month and are trying to, raise a child single-handedly, and you still get up every morning able to get your child here, getting your school, many have another job, it's mind-blowing to me. So I think we all need to sort of take a step back from our own experience, because I think it's easy. It was easy for me years ago to think, oh, well, everybody was raised like me, but that's not true. And not like I was raised in Shangri-La, but I had a lot of privilege compared to, folks that come here. And I think, taking a look at that for yourself, and then for those around you, and just not putting your judgments and your understanding on other people. That's what I'd suggest that people do, because I think most people have had more privilege. Again, we're born into it. Same with poverty. It's not somebody's fault, So, and I think, that's a big one for me. And I think that in this country especially, we blame people for being poor, when those are mostly children and women. And I think we have no idea what it's like unless, you spend time listening. That's, for me, it's, take a little time. It's that old thing of, walk in somebody else's shoes, but to really not judge and to just pay attention. We're in real trouble there, because I think, we look at prosperity as money often, instead of thinking about it as sort of resources for support and social emotional help and all the other pieces that it is. So that prosperity is, and I think we need to really take a look at why 85 individuals have more wealth than half of the world's population. That's a problem. So, and I think that if we can spread that out more evenly, we'd all be more prosperous. But I think we have to pay attention and have some loving kindness for others, and just figure out ways that we can support each other in community. Be the change. Yeah. Oh, there you go. There it is. I think that's what we're doing all the time. I think, and again, I think all of us change all the time, and I think if we're, and I hate to be repetitive, but if you're not judging and you're listening and you're paying attention, then you're giving people the room to change and grow, and you're giving yourself that room. So I think we model that a lot. Addison County has had the lowest teen pregnancy rate in Vermont for over 30 years. And that's, we know, is largely because of the Addison County Parent-Child Center. Because we're also, not all parent-child centers focus on prevention, and we do. We go into the schools. We take kids to Planned Parenthood. We talk about that. We bring teams to talk about being teen parents. We do a lot of primary prevention. The other thing that we found also is that, and we haven't crunched these numbers in a long time, so they're old, they're probably 10 years old, the data, but what we found was when we went back and looked at, so the average, typically when a teen parent has a child, it's a 50% chance that that child will then be a teen parent, okay, statistically, and that's a national statistic, and now ours is less than 8%.